and we were looking for to provide better care. And our next team is exactly doing that. I would like to welcome Ken Pfefferkorn on stage from ECARIA. Ken, these are your 3 minutes. Yep. Use them wisely.
Hello. Okay, this is working. Good evening. My name is Ken Pfefferkorn. I'm co-founder and CPO of ECARIA, and we are building a digital care manager, which is supporting family caregivers to do their job with a digital application. But first, I would like to tell you why this is so important. There's something coming up. The caregiving industry is under pressure, and there's a huge problem, which we would like to address. And just the situation at the moment, we have about 4 million people in need of care in Germany, and we have about 3 million of them that are being taken care of at home by caregiving family members. Without them, the system wouldn't work, and the situation for them is very bad. The burden is enormous. To take care for someone, on average, takes 3 hours a day. And this is so much work that the average loss of income is 24%, which for many of them means poverty. The burden is so high that 70% of them report an extreme high level of stress, financially, mentally, and so on. And this is going on for 6.7 years. That's the time a nursing case is taking an average in Germany. So this is a very bad situation, and it's getting worse, because in 2030 we can expect about 5 million people, not 4.2. So this is increasing. At the same time, the support, especially the human resources who can help here, they are decreasing. For example, because of the pandemic. So the burden will be even tougher. Talking about human resources, taking care for someone is a very interpersonal thing. What can a digital app do here? We can't feed anyone. We can't help changing clothes. But we can help people to understand how this is done the best way. And this is necessary because advice is a very important bottleneck. Many of the caregiving family members have no idea what kind of support they're entitled to get, so they do not get what they're entitled to get. And they have no idea how to take care for someone at all. So this is a brand new situation for them. For this, we developed a vision. We advise and empower caring relatives digital and scalable. And digital is the only thing that can scale here. Second, so that everyone can request the services they're entitled to and is better able to cope with the tasks. This is extremely important. For this, we developed our digital care manager, which consists of 2 components, which are addressing the core problems. Number 1, at the left-hand side, you see the Pflegegrad pilot, which will help caregiving family members to understand what kind of services they can expect and how to get them the right way as quickly as possible. And second, the Care Academy, no more, care better. We have developed a system of smart learning courses, a smart learning platform that will enable caregiving family members to care better. So isn't there enough information already available in the internet? Yes, of course, but that's the way it's working. Taking care for someone is very complex. You go to the internet, you look for something, you find something, it's very complex, you don't know if it's right or wrong. So one question only leads to many more questions, and this is happening again and again and again, 6.7 years. So that's not the way it should be. So we think we should reduce complexity by guiding them, by taking the users by the hand and tell them what to do, when to do, and what's the best way to do that. For example, here, this is our Pflegegrad pilot, 10 steps that will take you on a journey to get your, the services and benefits that you're entitled to as quickly as possible, the best way possible. Sounds very simple, works like you can see on the right-hand side. This is so simple that you might ask yourself, is this really helpful? But it definitely works, and we know this from the user data that we can track. So we started 1 year ago. We have 20,000 users so far, which is great. But the conversion rate from leads to users is 40%, which is absolutely amazing. I didn't expect that. We get an average rating of 4 or 5. 70% would recommend the app. So everything is working fine. Why do we need this award? Caregiving happens in a very...
Sorry, I need to interrupt here now.
Still 20 seconds.
No, it's